Are we overreacting to measles? In 2019, Governor Jay Inslee of Washington declared a state of emergency because of 36 cases. In New York City, Mayor Bill de Blasio declared a state of emergency because of 285 cases. In 1960, before measles vaccines, there were 4 million cases of measles in this country. Comparably, there would have been 64,000 cases in Washington state and 174,000 cases in New York City. But neither in New York City nor in Washington state was a state of emergency declared because of measles infections back then. Prior to the measles vaccine, measles itself was not a cause of panic. We know this from things that were published back then. In 1962, Dr. Alexander Langmuir, the chief of epidemiology at the forerunner to the CDC, wrote that measles was a self-limiting infection of short duration, moderate severity, and low fatality. And the major pediatrics textbook at the time said that case fatality rates in the US have decreased in recent years to low levels for all age groups. How fatal is measles? Recognizing that it's been underreported in the past and that only 10% of cases were reported, we now believe that it's approximately 1 in 10,000 cases may be fatal, and that number may be exaggerated because we now know that we have vitamin A treatment, which has been shown to reduce measles mortality by as much as 60%. And vitamin A treatment is recommended by the World Health Organization, the CDC, and the American Academy of Pediatrics. And of course, we have better antibiotics to treat measles secondary infections than we did 60 years ago. Is the vaccine worse than the natural infection? For example, there have been 130 measles vaccine-related deaths since 2003 reported to the Vaccine Adverse Events Reporting System. During that same time, the CDC has confirmed only 3 measles deaths. Now, you might object and say, well, it's because we have many fewer cases of measles because the measles vaccine has been effective. And that's true, but also the reduction in tuberculosis, a disease for which we do not vaccinate, has been over 90% during the same time period. So the number of deaths has significantly decreased. And it could well be that even without measles vaccination, the number of measles deaths may have significantly decreased. We have a new study, March 2019, looking at 5,000 children who received MMR vaccination, and it gives us fresh data about adverse events from measles vaccination. 10% of the children went to the emergency department. 6.1% had severe grade 3 reactions, which could include a high fever to over 103 degrees, inconsolable crying, not eating, an extremely painful limb. 3.4% of the children developed a new onset chronic disorder, such as diabetes, asthma, autoimmune disorder, celiac disease, allergies. Certainly back in 1960, 10% of children with measles did not go to the emergency department. 3.4% did not develop a new onset chronic disorder. We also know that having the natural measles infection seems to be associated with a lower rate of cancer and fewer allergies. But perhaps the most troubling concern is MMR vaccination associated with autism? There are 3 sources of information that suggest it might be. First, in 2017, Mawson reported that vaccinated children had 4 times the rate of autism spectrum disorder of unvaccinated children. In 2015, Congressman Bill Posey of Florida testified on the House of Representatives floor that he had received information from CDC senior scientist William Thompson that information had been withheld, or data had been withheld, from a 2004 pediatrics article, and that information was that African American boys vaccinated before 36 months of age had a significantly increased rate of autism. And the third thing is that a pediatric neurologist and former medical director of research at the Kennedy Krieger Center and faculty at Johns Hopkins University, Dr. Andrew Zimmerman, said it's now his opinion that in a subset of children with mitochondrial disorders, vaccine-induced fever and immune stimulation, these children may develop autism. So where does that leave us? If your child has a pre-existing susceptibility and has a problem with metabolizing vaccine excipients, your child may be at greater risk by receiving the MMR vaccine than by having the natural measles infection. I'm Dr. Alvin Moss. I've been a practicing physician for 44 years, and my opinions are my own. They're not those of my employer. Thank you.